lots of things about England I still look back at very, very fondly. I was a student of history, and I remember walking the fields of the Battle of Hastings. I remember going to Winston Churchill's hometown. I remember sort of walking through Westminster Abbey, and you see the crypts of all the English kings. And those were actually sort of fantastic, wonderful experiences for somebody in the early 20s. But there were two things about England I remember very well that I did not like very much at all. The first thing was English cooking. And if anybody's ever traveled in England, they manage to boil Brussels sprouts so long they go from green to yellow. And the lamb chops are roughly the size of the fingernail on your thumb. And it is just a brutal food experience. But something happened to me when I was in England. I got sick. I've had allergies for years, and I have a tendency to get bronchitis. And so I asked the folks at the campus where I went to go see a doctor, and they said, that's very easy. It's the National Health Service. There's no cost to go see him. So on I toddled across Earl's Court, where I lived, especially known as Kangaroo Court at that point. There were a lot of Australians, and across Kensington and Kensington High Street, which was sort of the height of fashion, and went to a British doctor's office, where I sat from 7 o'clock in the morning to 4:30 in the afternoon. And when I finally got an opportunity to see him, he said, you crazy Americans, you get sick all the time, you want antibiotics, you don't need it, just go home, you'll be fine in 3 or 4 weeks. That was a minute-and-a-half conversation after waiting roughly 7.5 hours. That was my first experience with the British healthcare system. And thankfully, I got well enough. It was my last experience with the British healthcare system. But that lesson has stuck with me for a long time. You know, I think people in Washington understand, and people in this audience understand, there are some things wrong with the U.S. healthcare system, but there are some things that absolutely work very well. And any changes in the healthcare system are going to bring things that will be a plus, and actually will bring lots of things that are minuses. Now, this is interesting to see a former politician actually taking money out of his own wallet, but this, folks, is a dollar. And when anybody on Medicare goes to see the doctor, Medicare pays their bills. There's 65-year-olds and seniors. And this is how much, roughly, Medicare pays for the cost of that treatment. About 75% of what it really costs. Now, this is one of the sort of fundamental flaws in the proposal in Washington, is that the U.S. government is going to be able to save money by cutting Medicare expenses to redirect to other expenses. So now instead of 75 cents, now they're going to pay 60 cents on the dollar. Well, if you're a doctor or a hospital, how do you make that up? The way you make it up is by what's called cost sharing, which means for everyone in this room who has private health insurance, when you go, you don't pay $1 for the treatment. Your insurance company pays $1.25 or $1.35 for the treatment. So the fundamental economics of trying to cut money from Medicare to spend more money on healthcare spending just doesn't work. And John Stossels was talking earlier about it being a Ponzi scheme. It's the greatest sleight of hand trick of all time. It is just not going to work. Now, as Vicki told you, in 1992 I was a member of Congress. I was a member of the Energy and Commerce Committee. And I actually was a member of the Energy and Commerce Healthcare Committee, which actually had the primary jurisdiction over the Clinton Healthcare Plan. And the great story of the Clinton Healthcare Plan is the story of what's going on in this room today, is that lots of people talk publicly about how much they like it, but privately they told you a very different story. Now, when I was in Washington, I had a fundamental point for my staff was to say, anybody who comes in I meet with. And I always used to meet religiously with organized labor if I didn't agree with them on most issues. So I can remember the teachers union, for example, coming in the room, closing the door, and we went over 6 issues that the teachers union cared about passionately, and I probably was with them on 2 and against them on 4. And then they said, okay, now here's what we're really going to talk to you about. Don't touch our health care plan. We love it. So here was the cornerstone of the folks you think who would be lobbying for the health care plan, who behind closed doors said very clearly, you can fix the health care system, but leave our health care alone. So as I stand before you tonight, I just want to tell you that if we make the changes that are proposed to the healthcare system, we may solve some problems, but we run the risk of giving up innovation, we run the risk of giving up medical device innovation, we run the risk of giving up prescription drug innovation, and most of all, we give up our opportunities for freedom. As I said earlier, there are lots of things from England I took back with me, very, very, very many fond memories, but one Saturday afternoon that dragged on for 7.5 hours convinced me of one thing. No thank you. There's lots of things that I like about England,